Vital signs are one of the most basic but most important parts of nursing care. They help us understand how a patient's body is functioning and whether their condition is stable or changing. In this video, I will explain vital signs in a simple way and easy way, especially for nursing students who want to build strong foundations and who want to do the OSCE as well. Vital signs are not just numbers that we write down. They give us early information about infection, pain, dehydration, respiratory problems, or deterioration. Regular monitoring of vital signs helps healthcare staff make them timely decisions and keep patients' safety. Before checking vital signs, it is important to maintain basic infection control, introduce yourself, and explain the procedure to the patient. Clear communication helps patients feel comfortable and builds the trust. Gaining consent and ensuring privacy are also important parts of professional practice. Temperature tells us how well the body is regulating heat. It can be measured using different methods such as oral, tympanic, or axillary. When checking temperatures, it is important to use the correct technique and observe whether the reading is within the normal range or requires further attention. Pulse assessment provides information about heart rate and circulation. While checking the pulse, it is important to note the rate, rhythm, and strength. Any unusual findings should be monitored and communicated appropriately to ensure patient safety. Respiratory rate is very important indicator of a patient's condition. Changes in breathing can be an early sign of distress. Observing the rate, depth, and the pattern of breathing helps identify potential respiratory issues early. And the blood pressure reflects how effectively blood is circulating through the body. Accurate measurement requires correct cuff size and the proper positioning. Abnormal blood pressure readings may indicate underlying health problems and should be followed up as needed. Oxygen saturation measures how much oxygen is being carried in the blood. Low oxygen levels can affect vital signs. Proper placement of the probe and awareness of the patient's overall condition are very important when assessing oxygen saturation. Pain is often referred to as the fifth vital sign. Asking patient about the pain and using the pain scale helps in understanding their comfort level. Effective pain assessment supports better patient care and recovery. After assessing vital signs, accurate documentation is very essential. Any abnormal findings should be communicated to the appropriate healthcare professional. Documentation ensures continuity of care and helps track changes over the time. Common learning points includes like practicing correct techniques, communicating clearly, and understanding what each vital sign represents. Building confidence with vital signs comes with the repetition and real life exposure. Vital signs may seem simple at first, but they play a major role in patient safety. Taking time to understand them properly can make a big difference in clinical practice. Strong basics lead to strong nursing skills. If you found this video helpful, feel free to like and subscribe for more general nursing education content. Thank you for watching and I will see you in the next video.